Everybody asked me to share my work experience in this job. So hi everyone, in this video I would be sharing my work experience with you all, where I have been working in the Municipal Corporation of Delhi cadre and I have been allotted a maternity and childcare center where I have been posted at the post of General Duty Medical Officer, that is GDMO. So let's start without any further delay. So the work timing of this duty is from 9 to 3 p.m. where the day starts with the OPD. As the name suggests, it is a maternity and child healthcare center, so I just have to deal with all the women's and along with the children's. It is a care center, it is not a maternity home. What is the difference between a maternity child healthcare center and home is that in the center there would only be the OPD services, there is no IPD, there is no delivery or operations or admissions. Only OPD services are available there, while at the maternity home there are operations, cesarean, normal labor. So it's a kind of maternity hospital, but ours is the maternity and child healthcare center where only the OPD services and the vaccination services and along with that the COVID vaccination services are available. So mine is the maternity and childcare health center, so I just have to deal with all the OPDs. So I have to deal with all the cases to which general physician deals with, like I would be covering all the skin diseases or any kind of cold, cough, fever or any kind of abdominal pain, or if along with the same symptoms in the child also. So we have the pharmacy also in the center. So we can only prescribe those medicines which are available in a pharmacy. We don't prescribe any medicine which is they have to bought from the outside, because the services are free to them and the patients which come in the center are not financially stable, so they are unable to buy anything from the outside. So we have to take in the margin like what medicines we have and we have to prescribe those only. And there are no test facility available in the center. If you think of that you can prescribe them the CBC or you can prescribe them the UHE, then those services are not available in our center. In that case we refer the patient to the hospital which comes under the MCD cadre only, and they can take the further treatment from that center. So this is all about the OPD. So in the OPD I came across very cute children also, which I have shared the photo with you all. Okay, after the OPD is over, then my job is to take care that how my nearby area of the center is going through. Like I'll take all the data from the ANMs and the ASHA workers working there. They have to give time to time report to me, and they have to give or share all their data with me so that I can share that data to the higher centers. I have to monitor that they are what the ASHA work is, that they register all the recent pregnancies, and they have to monitor the population of that area. They have to take care, is the child vaccinated or not. So they would be sharing the data with me, and they have to bring the pregnant females in the center so that they can get the ANC care, the TT vaccinations and all the folic acid and iron tablets. They have to bring childs in the center so that they can have the time to time vaccination. So I used to check the data and their reports that how the performance is, and I have to evaluate their performance from time to time. After the ASHA and ANM, and there are many programs which come in between run, so I have to discuss all the upcoming projects or programs with them so that they can handle it better, because I have to instruct them that what new schemes are coming and how they have to perform in that. After that I take the surprise visits also in the field to monitor the data, what they are giving is actually true or not. And during the COVID period also there were many people who are not interested in taking the vaccination, so it was my job to spread the awareness in the nearby area so that they get promoted to get the vaccination done. So whenever there any kind of crisis comes like the COVID which came, so you have to do this extra job along with the maternity and child healthcare center, in which you have to cover the population, you have to take care the vaccination of that area is covered or not, and you have to promote if any case if in the one if out of 100 if one people is not convinced to take the vaccination, then I have to go to that person home, and I have to counsel them, and I just have to make my performance bad, so that I have to do my best so that my area gets 100% vaccinated. So if any time of crisis come that of this type in future, so you have to be mentally prepared, because at that time you are not under the MCD heads only. And at that time the powers go in the hand of district magistrate of that area. So they take monitoring that you are performing that. After my field visits are over, then we have the scheduled meetings in which every person posted in the different centers, they have to come together at the MCD center, and where they are informed about all the new projects, or how better we can perform in the future and give our best services. So you have to attend that meetings, and if sometimes you have the online, you usually get free after the 3 p.m. So the best thing in that is that you don't have any kind of emergency call, you don't have your night duties, there is no kind of stress. You can have a work-life balance which you always want, and there is not at all a single stress factor in this job. You can tension-free go to your home back and reach up to the 4-5 p.m. and the whole day after that is yours. You would not be getting any call from the department or from the center. You just do whatever you want. So that's the best thing in this job is. So now it's the time of the questions which you all have been asking to me. The first one is it a grade A job? Yes, it is a grade A job. You have been posted at the same post where the IS officer is. It is a gazetted A post. The next question is, does government provide free tours to CMS doctors? They don't provide you free tours, but they sponsor your trips. Like if you have to go if you have to go to the different place related to this work, then they give your money back of all the travel expenses which happen. But if you want to go abroad just to just enjoy a vacation, then they do not sponsor that. They only sponsor the trips which is related to work. Okay, the next question after that is, what facilities are given? The first facility is the salary, which is huge, and all the allowances like travel allowances, transport allowances, and dearness allowances, and HRA, house rent allowances. In these type of allowances you get the facilities. Other than that, there is no such facility. Other than that. Okay, can we live along with family in the provided quarter? There is no such kind of quarters where only the posted person can live. It is like it is a gazetted A job, so you can live either in the quarters which they have given or outside of that, and you can live with the unlimited members you want to live with. There is no such kind of foundation in this job. Next is how many leaves we get. You don't have to worry about leaves in this job. You just be tension free in this job, and you can take as many leaves as you want. Okay, the next question is, can a person be posted in his own home district after the UPSC CMS? Okay, that's a tricky question. Actually depends in which cadre you have been allotted. If you have been allotted the MCD cadre, then it is only in the Delhi. Now the option is there that you can switch in the east, west, east, north and south, but that option was not available in the previous time. Now all the MCD have merged, so in case of MCD you can only stay in the Delhi. If you are in the CGHS, so they ask you the preference about the states, but you cannot be sure that they provide you home district only. And in the case of railways, first you will be allotted in the options you have filled, like if the vacancy available there. If not, then you would be posted in the place where they want, but you can have the transfer in future. So possibility is there that you can be shifted to your home district, but not in the first go. Next question is the important one, that if I am a surgery PG, will they post me in the hospitals with established surgery department or in the rural PSC? There is no rural word in the case of UPSC CMS job. It is there when you are doing a state government job. If you are bonded in the states after the MBBS, so you have the PSC and the CSC, but in the case of UPSC CMS, you get a designated hospital, or you get to work in the dispensaries or the mainly centers where they have some facilities available. It is not like a PSC where there is only a single room and no room other than that, and you have to work in that. There is no kind of situation in that. You have a well established either the centers or the hospitals. And if you are a postgraduate resident, especially in the medicine, in the surgery, in the obs-gynae, pediatrics, any kind of clinical branch, so they prefer to post you in the hospitals so that you work in the field which you have done your post graduation in. But if somehow the vacancy is not available, so for the temporary basis they post you in the centers, and once the vacancy get available in the hospital, they shift you to that hospital. So their preference is to post you main in the hospitals if you have done the post graduation. But if you have done the MBBS, then they prefer you to post in the different centers. So the differentiation in this is they prefer postgraduates to work in the hospitals, and if the MBBS, they prefer to post them in the different centers. So I hope you got many of your queries resolved in this video. So all